Hi guys, hope you're doing great. Good to see all of you once again on a cold December evening. The objective of today's session is to talk about the test and the explanation series for NEET PG that I'll be conducting. This is starting from 23rd of December, and the rationale behind why the TNA is being conducted is basically that we may not be knowing everything, but then the most important thing about NEET PG and INICET is that we just need to make fewer mistakes than others because we keep on reading the same content, but then it really boils down to doing the match practice. So in my opinion, why I am doing it is one, because of obviously the requests that came, and then I think that teaching is a passion for me. So I thought that, okay, bring it on and let's do this. So the methodology would be to train you for the real match practice. I'll give a simple example for this. You guys have read pharmacology, you've read medicine very well. All of you know contraindications for beta blockers, indications when you would be using beta blockers. But when it comes to the exam, you will notice that lots of time they will put up those words which are gonna eat up into your time. It's like you literally have to filter the noise. होता यही है कि हमें लगता है कि यार ये इसका आंसर होगा, और सरप्राइजिंगली जब रिकॉल होता है तो वो उसका आंसर नहीं होता, तो वी टेंड टू get antagonized by that. But what I think is primarily we need to understand drug interactions are asked, drug indications, contraindications are asked, but they're asked in a very subtle fashion. So what happens is that if your eyes are not trained to pick up those subtle variations, then there can be like errors of judgment, in my opinion. And this test and explanation does the same thing. Like it helps you replicate the same environment which you would be getting in the exam. And because you will be doing this again and again and again with me, so because of that, you will soon get over that nerves. That is one. And second, your eyes will start going to the right answer. Now, I'm not saying that you don't have that skill. You already have that skill, but it is about polishing that skill on a regular basis. So because I'll be conducting this test every week in advance only, I have given you a schedule. I'll be coming to the schedule very, very soon. And I will be explaining to you the rationale behind this schedule also, because it's like there are some subjects which would always be favorite of students, but then when it comes to the paper, that may not be a favorite of the examiner ना. लाइक होता क्या है कि जो सब्जेक्ट मुझे अच्छा लगता है मैं उसको तो बहुत बार बार पढ़ूंगा, और मैं कह रहा हूँ कि आई एम ट्राइंग टू मेक दैट सब्जेक्ट रिलेटिवली स्ट्रॉन्गर, बट एट द सेम टाइम द एग्जामिनर मे नॉट बी वांटिंग टू आस्क मी दैट सब्जेक्ट. So when you analyze the paper of NEET PG 22 versus 23 versus 24 versus 25, you will notice stark contrast happening, and then simply relying on PYTs or PYQs will also not help. It's more about a in-depth analysis that would be that would be happening. And therefore is test and explanation may I'll be focusing on how to eliminate the options under pressure, that is under 1 minute. And because I'll be doing it for like 3 consecutive hours for every subject, you would be soon realizing that, okay, this looked at an answer to a question turned out to be different. So you have to basically pick up those subtle words that the examiner can be putting, and that can result in sudden change in answer. So application, right? I mean, the objective of this discussion or the objective of this test and explanation is to minimize the cramming. Cramming is important. मैं ऐसे नहीं बोलूँगा. To be a doctor, like we don't need very high IQ. I mean, higher IQ is like for those people who are, let me say, working in Elon Musk's company, who are working on a Falcon X rocket. That's the heaviest rocket in the world that would be taking men to Mars, or like people who are driving Mars rovers. I would say those are like super intelligent people. We doctors are not up to the level of those people, agreed, right? But then in our field, it's not about invention or innovation that we are doing. It is application of the known facts so that we can reverse engineer and find out what disease is the patient actually suffering from. So these subjects, especially physiology, pharmacology, medicine, they are all integrated, right? They are subjects which are in a continuation. We in our mind create कि ये pharma का question है, ये medicine का question है, या ये फिजियोलॉजी बेस्ड क्वेश्चन था, जबकि एक्चुअली में व्हाट हैपेंस इज that for examiner it is just a case. He will not distinguish into like whether this is general medicine or whether it is going to be a case related from surgery. He could begin with an acute abdomen, and then like the presentation can be that of pancreatitis, looking like pancreatitis, and turns out the patient was having diabetic ketoacidosis. So it is like that application that I will be teaching in this, and I would also be trying to cut down the noise, because most of the time question में क्या होता है कि like when you read a question over 30-40 seconds, there is a lot of unwanted information the examiner is deliberately given to sap your energy. And because our brain gets I would say dazzled by that fancy terminology, we tend to miss out on the common hints that are given in the question. So the objective or rationale again is like cut the noise in the question and identify the common exam traps. So hi guys, for those of you who are joining in, I just want to just briefly summarize what I have just said in the previous couple of minutes, that is getting our eyes to the right answer. So do comment in the chat box with respect to like which is your favorite subject and which subject do you find the most hardest. That would give you an idea about like I'll tell you why am I asking you to comment that. This would help me analyze also like what do you think is a weak or a strong. That's all perception in our mind. So this is the rationale, the methodology that we'll be doing. So every week, guys, I'll be coming live in the PrepLadder app, and there's a structured schedule that I'm giving you. And because the exam date is not been declared as of now, so we might be taking it very, very easy. But over a period of time, what happens is the moment the exam date comes, we go into a panic mode, and then we are like, अभी 12 subject कर लेते हैं, अभी 13 subject कर लेते हैं. Then that kind of thought process starts occurring, and we are not able to finish up everything. So abhi like give it the best that you've got, and the first subject that I'll be taking up is pathology, then subsequent is microbiology, because I think that they are two subjects which are very high yield as well, and they're very frequently asked in the exam. And sometimes for this subject, we think we know, but turns out like, sometimes the scores might not be very, very optimal. So the practice part comes in. So the common query that I got from a lot of students at the launch of this TNE 1.0 that I'll be conducting is like, how does it benefit me? मतलब like I have so many sources, तो भाई मुझे क्या करना है? Like मेरे को मतलब फायदा क्या होने वाला है इससे? So I'll just enumerate like NEET PG. It is the answer survives elimination. I mean, I'll go back a couple of years when we were biology students. Then we used to do like we just used to say this is the answer to a question. We never used to get into that rationale of excluding the options. So here it is like with practice, I'll be telling you like how to rule out options in spite of knowing everything. And it's not that it's guesswork. It is not a tukka baji that we're doing. It is like some scientific thought process that we're trying to put. And I cannot like vouch for the fact that it will work always. But yes, you will attend a test, and if you find it useful, you can. Otherwise, I mean, there are so many sources that you could be using. The timetable that I am taking here, this timetable is based on not the, some subjects are very energy intensive. And there are some subjects which are like very output. I mean, what matters is the output and not the input, because sometimes you might be spending a lot of time on certain subjects, but the output may not be that great. But there are some subjects where the output will turn out to be like very productive with relatively less time being invested. So you will notice that I have clubbed certain subjects. Like when we are discussing orthopedics, we are discussing it with radiology. Or like, just before orthopedics or radiology, I have put anatomy. So it's more of like, I would say, a structured pattern where like, because you have gone through the anatomy part, you'll be a little more comfortable doing the radiology part and the orthopedics part as well. So what matters is input is obviously critical, but then input should cause a max output, right? So that's the most critical thing, because if I'm trying to remember all the stagings of the various cancers in a single go, it is not possible for me to remember them. So we'll stagger them. We'll do it in a fashion where we go system wise, and that system wise would help you understand things relatively better. I mean, we are trying to blur the lines between the subjects. Abhi thought process is like the 19 compartments, but I have made them into 16, and I've tried to blur the lines between certain subjects. So that is of paramount importance. And then, yeah, burnout. Because abhi kya hota hai ki we keep on reading, but then the output is something that we may not be achieving. But agar aap test doge, so then you know that you have done something, right? Some process, some action process has been started, and repetition of comfort subjects is to be minimized. It is like the core subjects that are important. And this is one sheet, guys, which I think will critically help you, because ये जो critical यहाँ पे मैंने mention किया ना कि first reading में कई बारी you might be using two sources also. Now, if you're using those two sources and you are giving a TNE, right, the explanation part, at the end of it, I want you to write down what score you got. And if that score is not optimal, which in a lot of cases might be, then you need to go for the second and third reason. I mean, the priority of second and third reading should be given to those subjects where in the TNE you did not get an optimal part. And I can assure you the fact that in this sheet, अगर आपका अभी तो मैंने कुछ ही सब्जेक्ट यहाँ मेंशन किए हैं, बट अगर इसमें सब में टिक मार्क आ रहा है, राइट, विद रिस्पेक्ट टू द फर्स्ट रीडिंग, देन द स्कोर, द डिड यू अटेम्प्ट द टेस्ट, डिड यू अटेम्प्ट द डे on which I had asked you to, and then the marks that you got. If you are gonna be like putting this sheet on your study table and you keep on marking it, if you get tick marks in all these areas, that means that you're doing right. This is self-assessment of whether I am putting steps to cause an improvement. This assured, I can assure you one thing, like, we say that we are stuck at these particular marks, or we are stuck at that a particular GT score. But what we do is we tend to read the comfort subject. जैसे comfort food होता है ना कि भाई आप बर्गर खा रहे हो तो like it's like a comfort food. Similarly, there are certain subjects which are comfort subjects for us, and we keep on trying to read them only instead of trying to get into those aspects which are not our stronger subjects. I can if I put it like that. So in this, I would say sheet, you can call it like a time sheet of your self-assessment, which would be on your desk for next couple of months. If you are able to fill this up, and if this is getting filled up over the month of December, January, February, and you're putting tick marks 4 times for each of them, right? Because if you analyze this, you read the whole subject, you gave a test, you found it like, okay, I got these marks, but some subtopics were not good. So you did priority reading of those subtopics, and then you did the third reading to cover the entire course. So it helps you, get that confidence कि यार कि अच्छा मैंने कुछ तो किया है. Because otherwise, normally what I've seen is people trying to do 2 subjects or 3 subjects in one go, and when you try to do 2 subjects in the first reading, तो कुछ output नहीं आता. Believe me, guys. Trying to do two is like sailing in two boats. It really doesn't work. In my opinion, it's like get the goddamn monkey off my back. That is like get rid of one subject, move on to the next one, then get rid of one subject, move on to the next one. So that's like the approach that should be there. So this is like a sheet which I'll be, this sheet would be a part of the discussion. And every time I conduct a test, there would be an unannotated PDF that would be available to you before the test itself, so that you can note down in the PDF itself whatever the data that I'm telling you. And the annotated PDF comes subsequently is available in a downloadable format, or can be sent to you directly as well. The team will basically take care of it. The advantage of having that PDF is that even if, like, at the end of the day, like a lot of you I know might be interns, or you might be post interns, but you might be working at some other place where you might be doing a part-time job. So you may not be able to attempt the whole test in one go. But if you are having a PDF at your disposal, तो आप 5 क्वेश्चन किए, तो आप 5 का एक्सप्लेनेशन सुन लो ना. Like, I'm saying bits. So it's like before you're going for a duty, during the duty, after the duty, if you're still doing bits, man, you are giving up, you are yourself making yourself like, getting that bird's eye view of all the critical things that matter. So there would be like tests that are created in total sync with the NEET PG pattern. I'm not saying that I can replicate the whole thing, but yes, it will try to come as close to that possible on the basis of all the interactions that I have had with students in the couple of years. Now the sessions would be conducted in the evening hours, because the query of a lot of students is कि कब होगा, तो सुबह नहीं होगा. It would be all sessions are conducted in the evening hours only. Like in the evening hour, around 6 o'clock is when the test would go live. 6 to 7:15 is when you give the test, और उसके बाद में then the explanation part would be taken care by me. So it is like I mean, it will be time intensive, agreed, time intensive, but time is what I want from you. But what I want you to do is give me like 3 months of your life, give me those weekends on a Sunday evening when people would be chilling or relaxing and thinking कि यार कल से करेंगे Monday से, and you are bringing it spot on that particular I would say that particular evening itself, you are being proactive and you're trying to hit the nail on the head. That's the primary objective. So the schedule would be available. You can mail me at marwamedicine@gmail.com, or like, what I've tried to do is when it comes to these tests, I have tried to put them on a weekly basis. I've given substantial amount of time abhi. And in case the NEET PG date comes pehle, if the NEET PG dates come pehle, we can obviously prepone this and we can adjust it. But I'm not rushing into everything, right? I've given like good 1 month for studying core subjects. I have given like फिर जब छोटे वाले subjects आ रहे हैं तो you're noticing then we are putting a bit of pressure on your mind and we're trying to increase to from 3 tests to going on to 4 tests and going to 5 tests. So if you make it too dense, no, if I'm like conduct 2 tests in a week तो होगा क्या कि कोई भी subject खत्म नहीं होता. Then it's like pseudo confidence that comes in somebody's mind, or pseudo satisfaction of getting like that I have done something, but whether it's going to be effective or not. So invest like 5-6 days in reading a subject, allied topics as well, and then we go ahead and discuss these topics, because this is going to extend right up to May. So even if you are a aspirant who's going to be sitting for INI-CET May, then this is gonna be helpful in a sense that you can stagger your approach. And in my opinion, like do not form your own schedule, try to follow the schedule which is given, because this I have talked to a lot of students who have got very good ranks, and I asked them the order in which they studied in the last 6 months. When I spoke to them, I had very interesting observations coming up. Like they tried to finish ये मोटे वाले जो subjects है ना, चंकी जो subjects हैं, they did not leave it to the end. They finished this chunky वाला subjects towards the earlier part, and that helped them in improving their final outputs. क्योंकि last में यार आप नहीं कर सकते हो, if you say कि मैं microbiology या let me say medicine को last में करूँगा तो possible नहीं है. बट अनाटमी अभी पढ़ने का मतलब नहीं ना, बिकॉज आई विल फॉरगेट इट. बायोकेमिस्ट्री में मतलब कितना भी रट्टा लगा लूंगा, देयर हाई प्रोबेबिलिटी आई विल फॉरगेट इट, दो वील डू अ क्लिनिकल बेस्ड इंटीग्रेशन विद दिस, बट देन देयर इज अ लिमिट टू द अमाउंट ऑफ cycles and the reactions and the enzyme names you can remember. So this is a very, I would say, student input based, student input heavy, student input based schedule that I've tried to create. And then there would be mock test also where the entire complete discussion would be taken. So this would be like the schedule. We're keeping it simple, guys. No hanky panky stuff. And I think that if you would uh, go through with this with discipline, then I think you are on the way to going ahead with glory, I can say like that. And I mean, the objective is like this only, trying to make our lives relatively easier by putting more intensive effort at this particular point of time. So thank you so much, guys. If today's session helped you think more clearly, then stay connected, stay consistent, and keep hammering, as I say always. So that's the main mantra, the main motto. If you keep on like pushing yourself on a regular basis, then glory is gonna be on your way. I'm not saying that life set तो नहीं होती है कभी भी, वो तो हमारा रिलेटिव है. देखो, it's a relative thing कि whether you are satisfied with your life or not. Let's not get into that idealistic discussion of that. Let's keep it simple with respect to what is to be done, and what is to be done is a structured format that I've tried to mention. This is the timesheet that I would like you to fill up in the next couple of weeks, and if you start putting ticks there and keep on sending me snapshots of that, that means that you are on for simpler things in life. I mean, trying to simplify things in your life. So thank you so much, guys, for joining the discussion, and I'll see you again. The first test is scheduled for 23rd. This would be pathology, then is the microbiology one, and you get substantial time between them to read these subjects so that you can prepare optimally, and then reevaluate your performance, whether your source is sufficient or not. Because lots of time you are using a source, and हो सकता है कि उससे you might say कि मैं वो source को बहुत बार पढ़ लिया लेकिन क्वेश्चन नहीं सॉल्व हो रहे, तो मतलब there is something which is lacking, right? I mean, I'm not saying that I'll blame the source, but I think that maybe the presentation is lacking and is not sync with you. So maybe you might have to analyze and make some modifications in that. I'm not saying changing the source is like something which is a very big decision, but then you need to critically analyze, especially if you are the one who says that I've already given an attempt and like I did not get it. A coveted position, then like re-evaluation of whatever are some subtopics, because I would like to say in the end, like it's not the subjects that are weak, it is the subtopics that we tend to overlook. They are the ones which are the examiner in opinion is like more important than what we presume them to be. So thank you so much guys. Bye bye, take care and God bless you.